I was able to get a special guest, and her name is Caro Van Hove, and she is both the CEO of a new company called Avali, as well as the chairperson of the board of Sientra. Welcome, Caro. Good to see you.
Good to see you. Thanks for having me.
Yeah, you're welcome. I understand you're releasing a new product at this meeting. What's the name of it? What does it do?
We are launching a new technology called Avali, and it's a new approach to cellulite. So we've been a small little company that's been in stealth mode for quite some years. We've been studying the underlying anatomy of cellulite, and we've come up with a really cool new approach that I think might, for the first time, be a trusted and a very reliable approach to cellulite.
That's fantastic.
Yeah.
And yesterday you were presenting it and educating a number of physicians. I was fortunate enough to be there.
Yeah.
And about 40 docs, derms and plastics.
Derms and plastics, yeah. 40 physicians that are really intrigued in treating cellulite, that have studied the area for quite some time, and that really understand that there's a need for a different solution. And so we've brought those 40 together, a really excellent mix of plastic surgeons, dermatologists. So it's been a great meeting of great minds.
Great. Now, is this a device, or is it a box? Is it energy? Is it lasers? What is it?
Yeah, it is a single disposable, so no capital equipment, no repeat sessions. It truly is a manual instrument that doesn't require a plug-in, no exchangeable parts, that is uniquely engineered to treat the underlying culprit cause of cellulite, which is a septa, the fibrous bands. So again, this is a technology that will be a one-time treatment for the patient and a disposable for physicians.
Okay. So since the physicians aren't buying a large capital item, I would imagine this is more economical than those if they had to do that.
Correct. And also, it is a very versatile instrument in the sense that we can treat cellulite for the buttocks as well as the thigh, lateral, posterior thigh, through 2 small entry points that just need a steri strip upon closure and local anesthesia. So it truly is an in-office procedure with a single disposable and a single treatment sessions for patients. So economically highly advantageous.
So the patient doesn't have to go to sleep.
Correct.
And there's no downtime? Can they get off the table and drive themselves
Downtime will be swelling, bruising, some soreness, with very nice resolution of the bruising. And again, all the adverse events are very mild and transient.
Excellent. How can a patient find a doctor who does this? I mean, does every doctor in the U.S. have it now? Or?
No, we are just introducing the device to this group of 40. And our approach to launch is that we are going to proctor cases with those 40 physicians to really kind of replicate the success that we had in the clinical study, which, thank you very much, Dr. Stevens, you were our primary investigator. So we're going to replicate the success we had in the study into the real world. We're starting with this group of 40, and then we'll sort of expand upon that. So it's going to be a steady approach to commercialization.
I think that's fantastic because technique does matter.
Yeah,
and
technique matters.
We've all been sold a bill of goods over the years with cellulite.
That's right. Yeah.
And
well, we know the mechanism works, right? So it's a real mechanical solution for the very specific issue of cellulite. So we've studied what cellulite is caused by, and so you have the thinning of the dermis, you've got the enlarging fat cells, and then you've got these fibrous bands, right? But in all the studies we've done, which again you were a part of, right? No less than 12 cadaver labs. We realized that these fibrous septa are much more complicated. And so we have engineered a tool that can target those fibrous septa, that complex structure of fibrous septa, in a very precise manner and allows you to verify the job. So with that in mind, it's technique oriented, right? Which is we really want to help and support all of these cases and support physicians on doing the procedure really well, and then go from there.
Excellent. I agree. So how are you liking the American Brazilian Aesthetic Medicine
meeting,
ABAM?
I love it. To be amongst a group of such esteemed plastic surgeons, and then obviously we brought in a great group of dermatologists too, but it's an intimate meeting. The scientific content is high quality. The interactions, I think, are extremely productive and rich, and it's just great to be amongst a fantastic group of friends. So Feel very
and a
privileged.
little international flair.
And international flair, which, as you
Europeans,
know,
South
I'm
Americans,
Belgian,
and
so
you're
I feel
Belgian.
right at home. And Dr. Saltz is just a gem of a person and has opened up the conference for us. So very grateful to be here.
Yeah, so am I.
Yeah.
It's a yearly conference,
Yeah.
and we go between here and Brazil, alternating years. And I hope you come back next year also.
We sure will. We sure will.
Excellent. Okay, well, thank you very much
Thank you for having me.
being on the show.
Thank you for having me.
And
I
good
love the
luck
technology of
with
beauty.
Avali.
And I can't wait to talk more about Avali on the technology of beauty.
Avali.
So
Yeah.
there you go.